Good morning. As many of you know, I'm the first registered nurse to serve in the Missouri Senate. After years as an ICU nurse, I thought nothing could surprise me. But last year in committee, I heard an alarming statistic. Missouri has the third highest rate in the nation of people who have experienced domestic violence. That is why I chose to work closely with stakeholders and advocates, including the Kansas City Police Department, the Special Victims Unit from the Jackson County Prosecuting Attorney's Office, the Missouri Coalition Against Domestic and Sexual Violence, and my Senate colleagues, especially Senator Tracy McCreary. Together, we have crafted bipartisan solution to address this horrific crime. I am pleased to report that our legislation, Senate Bill 928, has been passed unanimously out of the Judiciary Committee this week and is ready to be brought before the floor. I wanted to express my appreciation to Committee Chair, Senator Schroer, for his support and for helping me move this important bipartisan legislation forward. This bill would streamline orders of protection to reduce the risk of additional violence against victims, at law enforcement, prosecutors, and court officials. This legislation also updates legal definitions of assault, domestic violence to clear the way for more efficient prosecution. And lastly, it modernizes the law by including technology language to the definitions of stalking and harassment. This was key recommendations from the Missouri Stop Cyber Stalking and Harassment Task Force. Bottom line, Missourians deserve to feel safe in their homes and their communities. Again, I want to thank my Senate colleagues and my House colleagues who have supported this legislation and for the hope, and it is my hope that the Senate floor leader brings it before the body as soon as possible. And with that, I'm going to turn it over to my colleague, Senator Tracy McCreary.
Thank you, Senator Lewis. I'm State Senator Tracy McCreary from St. Louis County. I appreciate all the work that my colleague, Senator Lewis, has done to incorporate a lot of the recommendations that came from the Stop Cyberstalking and Harassment Task Force. Without her leadership on this issue, those provisions would not have been included in her bill. So I just want to say thank you to her and the entire Judiciary Committee for working in a bipartisan manner. Another thing I wanted to address that's intimately linked to relationship violence is a bill that I'm working on in a bipartisan manner. State Representative Holly Jones from St. Louis County in Eureka has a similar bill that is called, colloquially called the cross-reporting bill. Ample research backs up the finding that there is a direct link between acts of cruelty to animals and violence towards humans. This includes child abuse, domestic violence, elder abuse, and other violent behavior. Children who grow up in homes with domestic violence often witness their pets being abused. My Senate Bill 899 tasks all experts of abuse to work together. This legislation creates a cross-reporting system, or a two-way street, for investigators of children, elderly, and vulnerable population abuse and animal abuse. Under the legislation, experts who investigate all types of human abuse and neglect would be trained to recognize animal abuse, and those who investigate animal abuse would be trained to recognize the signs of human abuse and neglect. If these professionals recognize any kind of abuse while out investigating claims, those abuses are reported to the appropriate professionals who then can go investigate. Quite simply, this cross-reporting bill would save lives.
Can you talk about that bill and what made you want to sponsor it? I know it's also bipartisan.
Yeah, so I have sponsored a bill and partnered with Senator Schroer on this, and it's to allow our APRNs, our nurse practitioners, to practice to the full scope of their training. Missouri has some of the most restrictive laws when it comes to nurse practitioners. 7 of our 8 surrounding states have less restrictive measures. Where I live, I've talked to several nurse practitioners who choose to work in Kansas versus work in Missouri because of the restrictions. Specifically, it's requiring them to work with a collaborating provider, which is expensive. Some of our nurse practitioners have to pay up to $50,000 a year to collaborate with a provider, and they're not really collaborating. They're just actually just giving them money. We've heard some folks say that it's a great retirement fund.
How are you anticipating that your legislation helping with nursing shortages in the state?
Yeah, I think it addresses nearly every county in the state of Missouri is a healthcare desert. We need more practitioners. I find it fascinating that in this building there's this turf war, and it's not like that in the real world as far as I think. There's enough sick population, there's enough healthcare deserts, there's enough aging for all of us. So it passed out of committee unanimously last year, and I'm hoping to do the same, and let's get it through the Senate. And bipartisan support, yes.
Yeah, what do you make of Senator Shore also sponsoring the bill? Do you feel like that's giving it a push that it needs to probably have a bit of an easier path versus just a Democratic bill?
Yeah, I think it's an issue that we agree on, and he is a strong supporter of this, and the committee I think is very favorable for it as well.